Ontario, I need you to wake up. Change is always hard. This is what the Ontario Health Minister Sylvia Jones said out loud on the record while hospitals across the provinces are firing hundreds of nurses, cutting personal support workers, and gutting the care that everyday Ontarians depend on to survive. Not inconvenient, not frustrating, to survive. I think we need to talk about what this change actually looks like, because she's making it sound like it's just something that we have to deal with. This is the change that she's talking about. The Ottawa Hospital is cutting 400 jobs, nurses and PSWs. London Health Sciences, like I mentioned, is eliminating nearly 300 nursing positions. Chatham, Kent, Hamilton, Niagara, the cuts are everywhere and they're accelerating. ER patients are now waiting an average of 20 hours just to be admitted, more than double the government's own 8-hour target. Surgical wait times have doubled since 2019. Hospital overcrowding has shot up 57% since Ford took power. And, Ontario already funds and staffs its hospitals at the lowest rate of any province in Canada. We would need to add 48,000 hospital staff just to reach the national average. And what did Doug Ford and Sylvia Jones do? They gave hospitals a 4% increase, which is actually a 2% real cut when you account for the 6% cost increase needed just to maintain current service levels. And that compounds a 2% cut from the year before. So that's about 7,500 nursing positions gone and about 2,500 hospital beds eliminated under this 3-year plan. And Sylvia Jones gets to say that the budget exercise is going well. And you know what? Change is hard. This is your mother waiting 20 hours on a gurney in a hallway. This is your kid not getting the care that they need because there's no one left to actually give it. This is your neighbor dying on a wait list that keeps growing because the government chooses to underfund the healthcare system and call this collapse leadership. But Sylvia Jones says change is hard. That's not change. That is abandonment. And we need to call it exactly what it is. Because I know a lot of people out there feel powerless, but we are not. We are a collective. They are counting on you to be too tired, too busy, too beaten down to fight back. We need to start organizing across this province. Make them see us. Hey, maybe we need to do a general strike at this point. When the government refuses to listen, working people have historically had one tool powerful enough to force the issue. And that's our labor. 94% of Ontarians support more hospital funding to prevent these cuts. 94%. That's not a minority and that's not an opinion. That is the people of this province speaking with one voice, and we are being completely ignored. We are not powerless. We are the majority, and it's time that we start acting like that. Because change is hard is something you say when you're rearranging furniture.